Hey, it's Jessica DeMassa with WTF Health, and joining me right now, I'm very excited to talk to this lady. This is Sarasohn Kahn. She is a big thinker, an advisor, a health economist,
that's right,
and an author. And
that's
so show everybody the book. Here it is.
Health Consuming by Sarasohn Kahn.
Yes, find that on Amazon now. All right, but we want to pick your brain. You got the book with us, and it's all about the consumerization of healthcare.
That's correct.
Give us a state of play. Where are we right now in the consumerization of healthcare?
So right now, the technical term is that the consumer is getting screwed by the American health system. And that is because the consumer, the patient, has become the payer. And as a payer, handling first dollars in health and high deductibles, increasing specialty drug costs, maybe 50% of the retail price for specialty drugs in some health plans. Consumers have to pay, but they don't have the consumer tools to use to be real health consumers. So by the end of the book, I call for the second part of the recommendation, which is to morph from health consumers to health citizens.
Okay.
And by that, we have a call for, in the rights column of rights and responsibilities of a citizen, the right to affordable, accessible care universally. So I call for universal health care. I don't say the type. I just say, does America want everyone to have access to health care or not? And number two, a privacy law that goes beyond HIPAA, like the GDPR in Europe, which is an opt-in system versus the opt-out that is HIPAA, GINA, COPA, and this patchwork quilt we have. In the middle, from the beginning of the book, from patient as payer to that health citizen sort of holy grail, we talk about the role that Amazon has played in priming health consumers, where we now know what good retail looks like. We could shop at Nordstrom, the Wegmans grocery store, Patagonia, REI, any number of companies I call out in terms of the role models of retail experience and good design. And now, as health consumers, we want that same experience, not just patient experience, but consumer experience. And that means we're feeling respected. And if we feel respected, we actually have better outcomes. So I connect to real data. There are over 500 footnotes in here from JAMA, New England Journal, research papers that point to the fact that a more activated patient costs less money, and that includes costs less money to me, the consumer.
Okay, so even to themselves.
Even for themselves. If you engage in health, have healthy lifestyles, and then you also become a role model for your kids, for your parents, for the people in your network. And we know from the research from Nicholas Christakis and George Fowler in their book Connected, what you do in your social network, whether offline or online, impacts the social networks of your peeps and the social networks of their peeps. So if you're a binge drinker, someone in your network is a binge drinker. If you quit smoking, though, someone in your network is going to quit smoking too. So you can create this virtuous cycle. Anyway, all those themes are wound up in the book with a whole chapter on digital health and retail health as
Oh my
well.
God, so much. I have so many things I want to ask you.
It's like easy to read, a short book.
Yes, it is. Okay, so I want to back up to one of the first things that you said. I want to back up to what you said about the healthcare consumer and how this might not be, this is not real consumerism because we're not given the right tools. So expound upon that for me. Explain what is missing in the healthcare equation here where this idea of consumerization is just not right. It's not the proper definition.
A couple of key things that are being discussed now on the campaign trail. We're in 2019 now, so we've got a lot of discussions about health reform. Number one, transparency. Transparency of prices, since we are exposed as patients/consumers to that first dollar in a high deductible or again to a prescription drug at the point of purchase retail. What is it going to cost me? Do I know ahead of time? Like I do when, say, I go to Amazon and do a search. Can you imagine if you go to Amazon or elsewhere and you type in arthroscopy and your zip code and you get a list of orthopedic surgeons who bundle a price that's consumer facing for arthroscopy, but you also get other patient reviews like Yelp style or health grade style for the doctor. and you get price and value all on there. And we know from various studies that consumers trust tech companies as much as they now trust health providers to help them manage health. That came out of a study in the book from PwC's Strategy and Group a couple of years ago.
Okay.
Well, when I show that data to state hospital associations where I do a lot of speaking, the hospitals are saying, but that's my business. My core business is helping people manage health, but consumers say, I don't know your value proposition, how much it's going to cost, and frankly, the consumer experience is not up to the retail experience I expect as a payer.
Right.
So transparency, tools, and the other issue is privacy, which I just mentioned.